Hey guys, how are you? It's Dr. Jordan, and today I want to do a quick ed puzzle on Lab 2, which is going to be talking about quick screens. So what you're going to do is you're going to pair up with a partner, and you're going to be working in dyads or two people throughout the semester. I encourage you, however, when you select a partner, don't pick your best friend. Don't pick somebody that's going to make it easy for you. I want you to pick somebody that's going to make you feel challenged so that when you get ready to go into the clinic, you are comfortable and confident in your skills. So I want you to think a little bit about what is range of motion and what is manual muscle testing. This is bringing back a little bit of time that you spent with Dr. Bennett. We're going to be talking much more about what range of motion is and what manual muscle testing is, and using clinical reasoning to dig deeper and to think out of the box about what is going on with your clients that you're going to be working with. So I'm going to take a minute now and have you answer a question. Okay, the next couple of slides are just going to show what normal range of motion is. This should be a refresher for you. Hopefully you've had this information. Hopefully you still have it someplace that you can find it and you can locate it and put your fingers on it. But we're going to be talking about this much more in class. But you want to understand what normal range of motion is, because if you know what normal range of motion is, then you'll be able to identify what is abnormal or what is not typical, what in the way that somebody is moving their body. The next thing is manual muscle strength. Again, once you understand what normal muscle strength is, then you're going to be able to understand what is not typical or what not normal is when somebody is working or doing an activity or functional task. You have to also remember that as an individual ages, normal muscle strength can vary. It's going to decrease throughout time and throughout a person's age. So keep it in mind. What is normal for a 22-year-old is not normal for a 75-year-old. And we're going to be talking much more about that in lab as we're doing some activities and really using, again, clinical reasoning and professional reasoning to pull information together. Okay, what is a quick screen? A quick screen is overviewing what a client's able to do. We do this because it saves a lot of time. As you've learned about manual muscle testing and range of motion, think about how much time it took you to measure one body part of one of your classmates when you were doing your practical. I think Dr. Bennett said you were given like 15 minutes to do a practical to show maybe one or two measurements for range of motion. You don't have the luxury of that in the clinic. So what the quick screen does is it allows you to use your observations and your experiences to see what is normal movement, how a person's able to move, and then take your time to dig deeper, to get more information on body parts or movement patterns that a person is having difficulties in. A quick screen also allows you to establish a rapport with a patient. This is your time. It's that quick 2-minute time that person's going to become comfortable with you. Think about when you go into a nurse's office or you go into a doctor's office, how you want that person to act to you or to introduce themselves to you. What do you like? What don't you like? So take a minute to think about that and answer a question. Okay, now we're going to look at a quick video. We're going to look at this video again in lab and we're going to break it down much more, but I'm going to take a minute just to look at it now. Whoops, I guess it's not going to do that. Here we go.
Hi, Ryan. Hi. I'm Wendy. I'll be your physical therapist today. This morning, what we're going to do is check the range of motion of your arms and to see how well you're moving. Okay? So what I'd like you to do is just follow what I do. Okay. So I'm going to have you lift your arms up overhead and come back down and back out up to the side. And now put them behind your head and the small of your back to either shoulder, same shoulder. Go ahead and then bring your arms in at your side and bring your elbows back. And then bring your arms straight out. Come and tuck them back in again. Palms down, palms up. wrists up, wrists down, open up your fingers, and make a fist. Good.
All right. Hi. I guess you get to look at me. So take a minute to think about that video. You can look at it again if you'd like to, and answer a couple of questions about if you saw anything different that you didn't expect in the video, or even how do you think that the client did when he completed the activities. Okay. In addition to quick screens, OTs often assess visual tracking. So I want you to refresh your memory about what are pursuits, what are circades, what does convergence mean. We also look at cognition. How is a person alert and oriented? What are their sensations? What is the balance of the individual? And are they coordinating both sides of the body together? During the quick screen, we're going to practice. So you're always going to introduce yourself. As you saw in the video, that physical therapist introduced herself. Okay, then you're going to make sure that the person is positioned correctly. You're going to explain what your reasoning is for doing this quick screen. And then you're going to have the patient follow your leads, much like Simon says. Then you're going to document the observations that you see that the client engaged in. This is a quick screen lab checklist. So labs, you're going to have 3 competencies throughout the semester, which we probably already talked about. And during this, it's just going to be a pass-fail. We're not going to be grading them on a rubric necessarily, but you're going to have to complete all of the components in each lab in order to pass the assessment, or in order to pass the quick or the competencies. So this is what you're going to be tested on. You're going to make sure you're introducing yourself. You're assessing a person's alert and orientation or cognition. You're also going to be looking at their visual abilities, okay? Even though it's not identified on here, that's certainly part of the alert and oriented and part of that rapport building component. You're going to be looking at their upper extremities, how they're moving them. More specifically, it's all detailed here. You're going to be looking at sensation in a systematic way. You're also going to be assessing coordination, and you're going to be assessing their balance. Okay, lab 3, you're going to be then completing the lab competency. When you're not completing the lab competency, you're going to be watching a video, and it's of a gentleman with a physical dysfunction. He has a spinal cord injury, and you're going to be practice writing SOAP notes. Now it says here you're going to be doing it with peers. Ignore that. You're going to be doing it individually. I want to make sure that you have the opportunity to write as many SOAP notes, which we'll do 2 or 3 throughout this semester, and I will provide feedback to you so that when you get ready to go into the clinic that you're feeling very comfortable with that. This is a SOAP note template. This is something that I believe, well, I'm not sure if Dr. Bennett gave you this or not. I know that this was something that Dr. Bacon used to use, but this is just a nice systematic, or not systematic, a template to use. But we'll be talking about this more in class. Okay, guys, that's it. I hope to see you soon, and let me know if you have any questions.